Psychosocial stress is the consequence of an imbalance between the adverse experiences that one meets in everyday lives and the ability to cope with such experiences. About 33% of the people report feeling extremely stressful during the day, while 77% of the people they experience stress that affects their physical health, and 73% of the people have stress that impacts their mental health to a greater extent. What measures can be helpful to deal with such kind of stress in reality? Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about how virtual reality training can help to cope up with psychosocial stress. Previous research has described how virtual training produces acute cognitive and neural benefits. Now, building on those results, a new study suggests that a similar virtual training can also reduce psychosocial stress and anxiety. Researchers from the Tohoku University's Smart Aging Research Center published their findings in the International Journal of Environmental Research and Public Health. Now, we all know that physical exercise benefits our overall well-being. But for some, such as neurological patients in particular, people suffering from cardiovascular disease and even hospitalized patients, physical exercise usually is not feasible or can be even considered very dangerous. However, similar effects may be brought about when using the immersive virtual reality. Now, despite initially designed for entertainment, this immersive virtual reality has attracted interest from the academic community as well, mainly because of its potential use for clinical purposes, since it allows the user to experience a virtual world through a virtual body. Now, in the current study, the researchers explored the effect on stress, adding another level to the beneficial effects of virtual training. Young, healthy subjects, while sitting still, experienced a virtual training displayed from the first-person perspective, creating the illusion of ownership over movements. The avatar that they created ran at 6.4 kilometers per hour for 30 minutes. Before and after the virtual training, the researchers induced and assessed the psychosocial stress response by measuring the salivary alpha amylase level, which is the crucial biomarker indicating the levels of neuroendocrine stress. The results showed a decreased psychosocial stress response and lower levels of anxiety after the virtual training, comparable to what happens after the real exercise. While a moderate amount of exposure to stress might be beneficial, repeated and increased exposure can be detrimental to health. This kind of virtual training represents a new frontier in countries where high performance demands and an aging population are in abundance. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.